Good morning, Chairman and the professors. I'm Ye Yunqing from Fuai Hospital. It's my honor to introduce TAORTA trial on behalf of Professor Wu Yongjian. Our trial is about the early 6 months usage of single antiplatelet or anticoagulant following by single antiplatelet after TAORTA, a multicentre randomized open-label clinical trial. About TAORTA leaflet thrombosis, what do we know? We know that the subclinical leaflet thrombosis very common after TAORTA. The average incidence is about 13%, often discovered within 6 months post-TAORTA. It was first reported in TCT Conference 2022. SOT is composed of thrombus at different stages. RCT is focused on antithrombotic strategy, confirm the high incidence of SLT under 4D CT. And SLT is associated with the symptomatic valve deterioration. From previous studies, we know in TAORTA patients without oral anticoagulant indication, single antiplatelet therapy is sufficient, but APT cannot reduce the artificial valve thrombosis. Anticoagulation can effectively reduce the thrombosis. However, long-term oral anticoagulant significantly increases bleeding and mortality. Another issue is that Chinese TAORTA patients are quite different from Western countries. Due to the high incidence of bicuspid aortic valve and more severe calcification, Chinese TAORTA patients has higher risk of thrombosis than Western countries. The incidence is about 29%. On the other hand, the Chinese TAORTA patients are more frailty and have lower body weight, so the risk of bleeding is much higher too. So what about the unknown? First, current antithrombotic strategy recommendations are based on earlier TAORTA trials with more elderly patients. Second, SLT under 4D CT is not mandatory to detect in the study design in published RCTs. Third, as TAORTA expanding to all surgical risk population, younger people, the best antithrombotic strategy considering valve durability is necessary. Fourth, data regarding the efficacy and the safety of antithrombotic strategy in Chinese patients, especially in RCT, is rare. So based on the characteristics of Chinese TAORTA patients, we designed an optimized antithrombotic strategy. The hypothesis is that short-term anticoagulant can reduce the incidence of thrombosis in TAORTA without significantly increasing bleeding, thereby improving the net clinical benefit. In TAORTA trial, 650 TAORTA patients were randomized to aspirin and the VK group. 6 months later, both groups used aspirin. The follow-up time is 12 months after TAORTA. The TAORTA trial started to enroll patients since September 2023. We have 15 top TAORTA centers in China participating in our trial. We include 18 to 85 years old, severe AS, successful TAORTA through femoral artery approach, using self-expanding bioprosthetic valve, because in China, the self-expanding valve usage is over 80%. The primary outcome is the net clinical benefit endpoint and the bioprosthetic valve thrombosis endpoint based on 4D CT imaging. We assume that on both primary endpoints, the VK group is superior to the aspirin group. Follow-up visits are at 1, 6, and 12 months after TAORTA. 4D CT examinations are acquired at 6 and 12 months. The protocol has been published online. We also have multiple quality control methods to ensure the trial is high quality conducted. Finally, we hope that the China first TAORTA antithrombotic RCT will achieve good results and will present a new optimized TAORTA antithrombotic strategy to the world. Thank you. That's all for my presentation.